لا تنسوا الإعجاب بالفيديو والاشتراك في القناة تشجيعا لنا لنستمر بنشر المزيد إن شاء الله.
Before performing nasotracheal suctioning, make sure the patient has no contraindications to the procedure, such as a bleeding disorder, epiglottitis, or laryngospasm. Perform hand hygiene, ensure privacy, and introduce yourself to the patient.
Good morning, my name is Erin. I'll be your nurse for today.
Then identify her using two
I
identifiers.
need you to verify your full name and date of birth.
I'm Sarah Candy, April 3rd, 1957.
Thank you.
Place a pulse oximeter on the patient's finger and leave the device in place.
Raise your head up a little bit so you can breathe a little bit better.
Help the patient into the semi-Fowler's position or help her sit up. Put on a mask, goggles, and face shield if splashing is likely. Prepare your equipment by connecting one end of the tubing to the suction machine. Turn the suction device on and set the pressure to the lowest level possible that will effectively clear secretions. After checking the pressure by blocking the end of the tubing, place the open-ended tube near the patient within easy reach of your work area. Now prepare the suction catheter by opening the suction kit or catheter using aseptic technique. If a drape is available, place it across the patient's chest or on the overbed table. Fill the tray compartment with about 100 milliliters of sterile normal saline solution or sterile water. Open the water-soluble lubricant and squeeze onto the open sterile catheter package. Be careful not to touch the package. Depending on your agency's policy, you'll now apply either a pair of sterile gloves or a sterile glove on your dominant hand and a clean glove on your non-dominant hand. Use your dominant hand to pick up the suction catheter without touching any non-sterile surface, and use your non-dominant hand to pick up the connecting tubing. Attach the catheter to the tubing. To make sure the equipment works properly, suction a small amount of normal saline from the basin. Increase the patient's prescribed oxygen flow rate, instructing her to breathe slowly and deeply. Lightly coat 6 to 8 centimeters, or 2.4 inches to 3.2 inches, of the distal end of the catheter with the water-soluble lubricant.
Miss Kennedy, I'm going to go ahead and suction down your nose into your lungs to help get out some of those secretions.
Using your non-dominant hand, remove the oxygen delivery device. Ask the patient to inhale deeply. Use your dominant thumb and forefinger to insert the catheter gently but quickly into one of her nares as she inhales. As you insert the catheter, do not cover the catheter vent. Follow the natural course of the nares. Orient the catheter downward slightly. Don't force it. If you feel resistance, you've probably hit the carina. In that case, withdraw the catheter 1 to 2 centimeters, between 0.4 and 0.8, between 0.4 and 0.8 inches before applying suction. When you're performing nasopharyngeal suctioning, a good general rule is to insert the catheter to roughly the same depth as the distance from the mouth or tip of the nose to the angle of the mandible. In adults, that's about 16 centimeters, or 6.4 inches. In older children, 8 to 12 centimeters, or 3 to 5 inches. And in infants and young children, about 4 to 7.5 centimeters, or 1.6 inches to 3 inches.
If you're performing nasotracheal suctioning, insert the catheter about 20 centimeters, or 8 inches in an adult, 16 to 20 centimeters, or 6 to 8 inches in an older child, and 8 to 14 centimeters, or 3 to 5.5 inches in a young child or infant. In some instances, turning the patient's head can help you suction more effectively. Turning it to the right will help you reach the left mainstem bronchus, and turning it to the left will help you reach the right mainstem bronchus. Apply intermittent or continuous suction by placing your non-dominant thumb over the vent of the catheter for 15 seconds or less. At the same time, slowly withdraw the catheter as you roll it back and forth between your dominant thumb and forefinger.
Go ahead and cough for me.
Then encourage the patient to cough. Replace her oxygen device and instruct her to inhale deeply. Assess for the need to repeat the suctioning procedure, but don't perform more than 2 passes. Watch for alterations in the patient's cardiopulmonary status. When possible, allow adequate time, at least 1 minute, between suction passes to allow for ventilation and oxygenation. Rinse the catheter and connecting tubing by suctioning normal saline until the catheter and tubing have been cleared of secretions. When you've finished suctioning, detach the catheter from the connecting tubing. Loop the catheter around the fingers of your dominant hand and pull your glove off inside out around the coiled catheter to isolate any contaminants. Remove your other glove and turn off the suction device. Dispose of your supplies in the appropriate receptacle. If indicated, reset the patient's oxygen to its original level. Her blood oxygen level should have returned to baseline by now. Remove and dispose of the drape and reposition the patient.
Hi, Miss Kennedy.
Oh,
Are you doing okay?
feel better.
You're breathing a little easier?
Yeah.
Place an unopened suction kit nearby for future use. Help the patient into a comfortable position and provide oral hygiene as needed. Perform hand hygiene and document the procedure, including your pre- and post-suctioning assessment, the amount, consistency, color, and odor of the patient's secretions, the size of the catheter you used, and the patient's response to the care.